Hi, I'm Alan Ackrey, and I'm an emerge doctor at St. Michael's Hospital. Recently I had a good day. The best thing in a very long time happened. I was lucky enough to get the COVID-19 vaccine. And because I work on the front line at a hospital, a bunch of people I work with got the vaccine too. For me, this was an easy decision. Yes, I want to protect my patients, but I also want to protect my family. But I know my being vaccinated is an early step in ending this global emergency. We know there are lots of questions about the COVID vaccine, so why don't we take a few minutes to better understand these vaccines, answer common questions, and learn about why they're safe so you can make the best decision for yourself and your family. First up, vaccinations have been around for over 200 years. If you have time later, Google smallpox and see one of the most horrible diseases ever inflicted on humankind. Smallpox doesn't get a lot of attention these days because it is a disease that no longer exists because of vaccines. Today's vaccines are held to super high safety standards, and the COVID vaccines have been tested on hundreds of thousands of people. Several COVID-19 vaccines have been approved, and they all do basically the same thing. They expose your cells to something that looks like the virus, not even the real thing. The idea is that your body will recognize COVID and fight it quickly and efficiently. Since all these approved vaccines only produce one small part of the virus, you cannot get COVID. When I got my vaccine, my arm was sore for 2 days. On a scale of 1 to 10, I'm saying 3, and I have a low pain threshold. One friend reported muscle aches, and another felt tired and had a mild headache. But none of these lasted long, and also minor symptoms are a sign that the vaccine is working. In this situation, I prescribe ice cream. Also, full disclosure, yes, I was lucky enough to get the vaccine, but I keep practicing the basics to protect my family and coworkers. I wash my hands, I wear a mask, and I physical distance. I urge anyone lucky enough to be offered the vaccine to take it. Take it for yourself, take it for your colleagues, take it for your family. This is the step forward we all need to get back to normal. I hope I have helped you better understand the COVID vaccine so you can make the best choice for yourself and others. The vaccine helps to protect you, and if most of us get the vaccine, we can create a herd immunity and protect others, including the few and vulnerable who can't be vaccinated for medical reasons. As we all work together to end this pandemic, won't it be great to say, I got mine.
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 Go get yours.